This is Mr. A. He is a 41-year-old Caucasian man who's a little overweight and drinks about 4 to 5 cans of beer every day. For the past 2 months, Mr. A has been experiencing dry mouth with increased thirst. He's noticed an increase in appetite even after eating a meal. Mr. A is urinating more than usual and always feels exhausted. He's been trying to ignore these problems, but now he's starting to have blurred vision.
Honey, it's been difficult for me to see lately. Everything looks so blurry. I feel like I'm going to pass out.
What? You're worrying me, babe. I'm taking you to the ER right now.
Mr. A was admitted to the hospital where his nurse performed a head-to-toe physical assessment. She called Mr. A's doctor explaining the symptoms he is experiencing.
Thank you, nurse. It sounds like Mr. A is a little dehydrated right now, so give him lots of fluids. He seems to be experiencing signs and symptoms of high blood sugar, so I want you to perform a hemoglobin A1C test. Tell Mr. A I will check up on him in the morning and we'll share the laboratory results with him then. Mr. A, your blood test shows your hemoglobin A1C levels are at 6.8%. You are considered pre-diabetic. You still have the chance to bring these levels down to a normal range if you start making lifestyle changes now. If you don't, you could become diabetic. Mr. A attempted to make lifestyle changes but failed. He had a medical emergency. You say you are currently experiencing symptoms of fatigue, blurred vision, and dizziness.
Mr. A, your blood test shows that your hemoglobin A1C levels are at 8%.
Oh no!
Mr. A has just been diagnosed with
Type 2 diabetes.
What is type 2 diabetes?
Type 2 diabetes means your body does not recognize insulin. This is known as insulin resistance. Because of this, glucose levels build up in the blood.
What can I do now?
There's an effective medication to help treat your type 2 diabetes.
Let's learn about Metformin.
What is Metformin?
Metformin is the generic name. Trade names include Fortimet, Glucophage, Glumetza, and Riomet.
Metformin helps control blood sugar levels.
How does metformin work?
Metformin increases the body's ability to use the insulin it makes.
Metformin decreases your liver's glucose production.
Metformin decreases intestinal reabsorption of glucose.
Wow, sounds great. How do I take metformin?
Take it orally as prescribed daily, have to take it with a meal, and do not crush, chew, or split the tablets.
Any side effects?
Common side effects include upset stomach, cramping, vomiting, nausea, gas, and diarrhea. Serious side effects include lactic acidosis, hypoglycemia, hepatotoxicity, anemia, and chest pain.
Yikes! Anything else I need to know?
Tell the doctor if you ever had kidney or liver disease, heart failure, or are very sick, have any activity that can affect your blood sugar such as eating less or exercising more, are experiencing any serious side effects.
Remember, do not drink alcohol, exercise regularly and eat healthy. Do not take a double dose to make up for a missed one. If you miss a dose, continue taking usual dose at the usual time.
In case of overdose or emergency, call 911.
Metformin.
It treats type 2 diabetes.
It keeps you healthy.
It keeps you alive.
Thank you so much!
You are welcome. Here is a handout for you to take home. Take care!